First paper is effective enzymatic degradation on the mechanical properties of biologic scaffold materials. This is from the WashU group. I won't read the whole list of authors, but Dr. Anora will be giving the talk.
It's back and forward, and this is a laser pointer there.
I guess not.
Yeah, actually, I'm giving this talk on behalf of Corey Deacon, who is the senior author on this. Is a PhD who runs our biomaterials lab. Corey is expecting the birth of her first child and couldn't make it today.
All right, Brent.
It's not a very good excuse.
These are our disclosures. This project was funded through multiple sources, including the Musculoskeletal Transplantation Foundation, Covidian, the Washington Institute of Minimally Invasive Surgery, an NIH training grant, and some of the products were donated. Biologic scaffolds are comprised of extracellular material that either comes from a human or animal source. The properties of this material depend on multiple different variables, especially when you're talking about an allograft, in terms of its harvest site, whether it comes from the arms, legs, or back, donor characteristics that are very hard to put metrics on, the age of the patient, their comorbidities, whether they've had a history of smoking. The processing of these materials is proprietary to the companies, as these extracellular matrix undergo decellularization and sterilization, and that processing may have an effect on the actual graft integrity. Cross-linking is an intentional change to the graft to try to make the collagen more stable by intentionally adding bonds between the collagen matrix to decrease the amount of degradation of the material. This process of remodeling is really a balance between the resistance of it being enzymatically degraded during the same process of promoting the tissue remodeling with cellular attachment, neotissue deposition, angiogenesis. So this process of remodeling is a balance between those two processes. An imbalance, one way or the other, may alter the actual integrity of the healing site. Enzymatic degradation is done through collagenases and gelatinases, or MMPs, that are produced by both inflammatory cells and fibroblasts. Again, this function is to degrade the extracellular matrix and allow remodeling to occur in the healing site. The objective of this study was to evaluate the effects of in vitro enzymatic exposure on the mechanical properties of biologic scaffold materials, both allografts and xenografts, to get a better understanding in an in vitro environment how processing and decellularization and cross-linking may actually affect graft integrity as it undergoes this enzymatic process. Our hypothesis is that exposure of biologic scaffolds to an enzyme solution will result in decreased tensile strength over time, a decrease in tensile strain, and also a decrease in modulus. Modulus is the resistance to elasticity or stretching. It is also our hypothesis that cross-linking scaffolds resist enzymatic degradation and retain initial tensile strength more effectively than non-cross-linked scaffolds. So this intentional process of cross-linking will have a favorable characteristics in the mechanical properties of the grafts. We looked at several different commercially available products, both from animal and human sources. We broke these out into non-cross-link and cross-link materials, so that we can actually compare the differences between the processing that occurs in decellularization and sterilization in these cross-linked grafts. One of the difficulties with this, however, is that the cross-linking that is performed is done differently from material to material, so the actual cross-linking process may have may alter the effect. The methods are ATSM standard methods, where we make a dog bone shape of the biologic graft. We put this in a mechanical testing in uniaxial fashion to evaluate the grafts de novo. The grafts are then exposed to a collagenase material, S001 163 from Sigma Aldrich solution at 2, 6, 12, 24, and 30 hours. The grafts then undergo mechanical testing after this exposure period. In terms of results, after long exposure periods, some of the scaffolds degraded severely and could not be evaluated, specifically small intestinal submucosa and non-cross-linked bovine pericardium. Similarly, to the allografts were immeasurable after a 12-hour exposure. In terms of results, we saw consistently what our hypothesis was, in that porcine, the tensile strength significantly reduced at 30 hours for those grafts that were testable, meaning that the strength decreased over time, whether it was cross-linked or uncross-linked. Similarly, tensile strengths increased. One of the interesting things was that tensile strength increased for one of the grafts at 30 hours. This is a bovine pericardium that's cross-linked, and the etiology of that is not understood. The tensile strength did not change over time for the small intestinal submucosa, but was at the lowest level of all the grafts and was immeasurable after 6 hours of exposure. In terms of porcine dermis, if you categorize these as cross-linked versus uncross-linked, the cross-linked materials had a greater tensile strength, a greater tensile strain, and a reduced modulus at 30 hours. This likewise was similar for the cross-linked bovine pericardium versus uncross-linked bovine pericardium, thus a potential mechanical advantage of cross-linking in an environment of enzymatic degradation. In terms of human dermis, there was one interesting finding, and that is before enzymatic exposure, one of the allografts had an increased tensile strength, increased tensile strain, and decreased modulus. But after enzymatic exposure, we actually saw a reverse in the mechanical properties of those materials, essentially meaning that the processing, which is proprietary for the company, has alteration in the effect of that material after enzymatic degradation. So in summary, all except Paragard and Surgicis demonstrated reduced tensile strength over time as predicted by hypothesis 1. The cross-linked scaffolds more effectively resisted degradation than their non-cross-linked counterparts. Again, a mechanical advantage of the cross-linked materials. However, one material did not resist degradation, and this may be a result of how heavily cross-linked the material is. Also in conclusions, the materials that deteriorate rapidly in vitro enzymatic exposure may be at risk for in vivo degradation depending on the wound environment. There is some caveats to this. The experiments presented are an in vitro model, and the in vivo environment is very complex. The collagenase that we used is a standardized collagenase, may not be representative of a tissue environment. Thank you very much.
Any questions? I missed your disclosure slide. Were any of these, was this study funded by any of the graft companies that you?
So we had some funding from Covidian, and we also had some donated materials from Covidian.
Dan Margolin from Kansas City. We met last week. My question is related to hiatal hernia repairs, and I don't know if it's okay to ask if you have a personal bias towards which product you use in particular to reinforce hiatal hernia repairs. I found that the Surgicis seems to, it's kind of interesting that it didn't show a lot of enzymatic degradation, because I found that in an infected environment, which is obviously different than hiatal hernia repairs, the Surgicis seems to dissolve pretty quickly and doesn't even seem to be there after a short period of time. We were using the Surgicis crural patch and have since gone away from it because we don't really think that it carries very good strength, and I've started to try to use the Gore-Tex product, which is a synthetic, and I'm interested if you have any comment on that as well.
Well, I think any biologic graft, whether it's an allograft or a xenograft that's exposed to infected field, will lose its mechanical properties extremely quick, and so I don't think they're all at risk. In terms of materials that are ideal in that situation, there isn't an answer to that question yet. If you look at clinical trials at that, with that, there's been no comparative trials, and I think this is the most frustrating part of this whole market of materials, is that they're utilized quite readily, but we don't have any clinical information or understanding exactly, does one have a better property in terms of utilization for abdominal wall, breast reconstruction, hiatal hernia. And in some ways, we're moving backwards in that we've done some of these testing where we've implanted these materials and explanted them and look at mechanical properties. So we know that there are some differences. We don't know how to explain them. So now we're doing these tests to try to get a better understanding, because there's so much that's proprietary about how the processing occurs, unlike a synthetic mesh that's very basic. And so, yeah, unfortunately, I have a lot more questions like yourself than answers.
Do you have any opinion or experience with the newer dissolvable synthetic meshes, such as the Gore-A product?
Well, I think if you look at bioabsorbable synthetics as a whole, I think there's a real opportunity here at mimicking what these biologic grafts do, but doing it at a fraction of the cost. It's much easier to control the environment. You don't have to worry about the synthetic having smoke for 20 years, or whether it was harvested off the back or the thigh, or something else. And so it's a much more controllable situation. It's a matter of, do you get the adequate remodeling? And again, you can do it at the fraction of the cost. So my opinion is, in the future, that'll be an area of significant innovation and development.
Thanks.
Brent, just one comment. I have to thank you for continuing to work on this. When Rich Pierce was with us, he kind of taught us a lot about this biologic mesh. I think there's a lot of questions that need to be answered. So thanks to your group for continuing to work on it.
Thank you very much.